Kristen, do you want to introduce yourself?
Just a second. Yeah. Sorry, I was eating a little snack. I'm Kristen Amundsen from Goodwill, Colorado. Nice to see you guys today.
And Kristen is our vice chair.
Yes.
And so I think we're going to start this morning with some introductions going around. I'll start with the two people I have here in the room with me here at PPACG from PPACG. So Laura, Melissa, do you want to introduce yourselves?
Hi, I am Laura Cruz. I am the mobility coordinator for PPACG. And next to me, I have.
So I'm Melissa, and I'm the program development administrator here. And we're sitting at the back table behind the computers. So
yeah. And then I'm going to introduce to my left here, turn it over to Kate just to say hi, and that we'll have more introduction later.
Kate Hatton with Homefront Military Network.
And Kate is going to be on our panel this morning along with Chad Ferris. Chad, do you want to say good morning? That was a big wave. Chad's on mute, I guess, this morning. And then we have also, I'm going to name people so they have an opportunity. John Carroll.
Yeah, good morning, everyone. John Carroll, Special Kids, Special Families, Development and Communications Manager.
Paul Spots.
Good morning, everybody. I'm with the Independence Center.
Okay. Chelsea Gondek.
Hey everybody, my name is Chelsea and I am the Director of Planning and Mobility for the Downtown Partnership.
Okay. Deanna Rumsey.
Good morning, Deanna Rumsey, Advocacy Specialist at the Independence Center.
Jessica McMullen.
Jessica McMullen, the Policy and Communications Manager for the Pikes Peak Area Council of Governments.
Allison Burns.
Good morning. I am with Mountain Metropolitan Transit. I am the ADA coordinator.
Rosa McCormick.
Hello, I am with the City of Fountain and I am the ADA coordinator and transportation coordinator.
And then I have somebody who's joined us by phone number that I don't know who this would be.
Good morning. This is Jason Bueno with SilverKey.
Good morning, Jason. Thank you. Anybody else that I have not mentioned this morning? Anybody else on the call? All right. Well, let's get started. Do we have a quorum this morning? We do. Great. So looking at the agenda, I'd like to ask for a motion to approve the agenda and the minutes. As a consent
Kristen
agenda.
Amundsen, motion to approve the agenda and minutes.
Thank you. Do we have a second?
Chelsea Gondek, second.
Thank you. And this morning, I don't believe we have any public comments, but I can pause if somebody had something that we weren't notified in advance, but if somebody had something burning that they needed to share. All right, well, I think we're going to jump right into our topic then. Today, we're pleased to have some guests with us to talk about veteran transportation. This has become a topic not just for our community, but communities across the country on what we can do to better provide access to veterans who are trying to get to their medical services and other critical services that they need. So we thought, why sit here and speculate? Let's go to the people who know better than we do what veterans need and what veterans are trying to do. And so we lined up Kate Hatton and Chad Ferris. I don't know if our other guests joined us this morning. It doesn't look like it at this point. They may join later. But I kind of gave each of our guests a quick outline in terms of introducing themselves, how they're involved in veteran services, what gaps that they see, suggesting ways that the community can step up, and then helping identify some possible funding sources for those of us in the transit sector. And so I think I'll give each one of them an opportunity to speak for a few minutes, and then when we're done, we'll go back and open it up for questions, if that's all right. So I'm just going to kick it off with Kate, if that's all right.
If I can figure out the microphone, can you hear me? Can you hear me now? Okay. Kate Hatton, Homefront Military Network. Our organization wears many hats, but we're collaborative. We work with 47 partners, including SilverKey, Pikes Peak Area Council of Governments, Goodwill, and the Independent Center, among others. And our goal is to really make sure that all the needs of service members, veterans, and families are met in this community and well connected. So we also provide direct assistance, financial assistance, and case management. So those who kind of don't know where to start or how to connect, we can help drive the bus and get people connected to the right services and help them with multiple needs. Usually, often, most of the time, veterans approach us. Oh, the county VSO is a partner too. Sorry, Chad, forgot to mention that. But the goal is to make sure people are connected to whatever those services are across the board, and we can provide that case management. So in general, from what our case managers tell us, big picture wise, a lot of people reach out to us for financial assistance. Some of that is helping them make sure that their vehicle is working so that they can get to their medical appointments or their jobs. Some of it is they don't have the gas or can't afford the gas to get to their appointments, or they have other transportation needs. It is a relatively small percentage of the bigger picture issue of needs, but one of many needs that we do see. Our team, the issues are really, and I don't think this is a surprise to anybody, transit isn't that great in this community. And so that's a challenge. And where are the bus stops and how long does it take? It takes veterans 3 hours to get to the Lindstrom Clinic sometimes, depending on if they're taking the bus and from where they're coming from, or if they have to go downtown to transfer, then to get to the southwest part of town or wherever. So are the services where where veterans are, and the transportation issues. So that's kind of a bigger challenge. There are resources and services, and I don't know the status, and I think there are a couple of folks at the table that aren't at the table here that would be able to answer some of that, particularly the VA, the Lindstrom Clinic folks, their voluntary services manager. It helps with transportation and works with DAV, is the other entity that provides medical appointments, usually from destination to destination, from here to the Denver Regional Medical Center, the Rocky Mountain Regional Medical Center for appointments. So longer distance trips. It's the in-town trips, I think, that is the biggest gap I think that we're seeing. And Chad may have a lot more detailed specific information as well. But those are some of the gaps that we're seeing in terms of how do we get folks from it's the access to services. And the way everybody's seeing too, gas prices are, I think, a growing concern for folks too. So access to gas cards, access to resources, telehealth, resources. That the pandemic has sort of given us one good thing in terms of accessibility that way, but a lot of folks like in-person meetings, and more as things will open up more, getting people access and trying to avoid some of that isolation pieces too, I think, are part of it. So those are sort of the things that we're seeing. Ways the community can step up to help. I'd like to hear from others before kind of digging into that too much. One of the things our team suggested is more opportunities for on-demand services. Can there be, rather than gas cards, can you get a gift card or a pass for Lyft or Uber or something like that, as a way to make that really a personalized, customized service? And so there may be things out there that are happening that we don't aware of, but those are some of the suggestions that our team came up with in terms of, short of revamping our entire transportation system, understand some of the limitations on the SilverKey does great, and Vita is great, but there are requirements for those services. And so whether it's this kind of siloed funding, frankly, it comes down to understand why there are limitations, because pots of money are certain things. But that's what we see. If you're not over 60, where you go? If you're not ADA, so all of those things kind of tie in terms of how do we get people to the right services. So making sure people know what the eligibility requirements are, how to connect, and making sure that everybody knows what's available. That's half the battle too, is that not everybody knows what resources are available. So I think knowledge of resources is another, kind of barrier. So I will kind of stop there and then figure out, and then let others talk, and then see what we can have a conversation maybe around what are some options. Because I don't think I wouldn't pretend to know everything. I'm just kind of saying what we're seeing.
Okay, thank you. That's great. Chad, I'm going to turn it over to you and let you introduce yourself. Chad, I'm going to turn it over to you next and let you introduce yourself and kind of go through what services you have over at the VA and some of the things that veterans need. Chad, you may be on mute. We're not hearing you, Chad.
Chad, if you're having issues, you can actually call in if you would like. That may help. I think he's typing in the chat.
While we're waiting for him to call in, one of potential resources through, we have our network care website where we can have a lot of resources connected online.
Mhm.
We can add a transportation sort of hot button so that people connect correctly. I know that there's a lot of sort of one call or options around that, but if there is an online resource, if we can help with that, whether to get all of the resources that are available, transportation needs, I'd love to be able to put those all in one place. So I would offer that as a potential step.
Okay.
One of the things, Kate, this is Laura Cruz. We are actually wrapping up and feel like I've been talking about this forever. It's taken some time, wrapping up a mobility guide that includes all the providers that typically sit on this call, but also had a military fellow do some research on more like regional transportation and how people can access that. So we will be putting that online probably this month or this coming month, May, and can connect you with that. I know Dave also, just each individual agency has their own resource. Just trying to create sort of a landing page for all resources that you could
Perfect. If we just link to that and make sure that's perfect.
Yep.
And while we're waiting for Chad to join us here, one of the things that we launched and Vita launched in January was we were made aware of Freedom Springs, the new facility that is outside the urbanized area and unserved by any type of transportation. So in January, we launched a stop that goes along our deviated fixed route that goes out Highway 94. So we are able to stop 3 times a day at Freedom Springs to bring those veterans into town and connect them with the in-town transit so they are not so isolated out there on the edge of the plains. So that, I think, was a wonderful collaboration and what I would call good communication in the community to recognize what that need was and who could serve that need. But that's what this is all about as an MCC, is what are those needs? Where are the gaps? And how do we as an MCC address those? And how can we work with veteran organizations to identify those gaps? So do we have Chad yet? Chad, can you unmute and join us?
Chad, you're still on mute.
Is that better?
Oh, there we go.
Sorry about that.
Yeah, Chad, you need to turn your computer on mute.
Is that better?
Yes.
Oh, we gotcha.
Winner.
Sorry about that.
We got you,
Yeah,
Chad.
so, yeah, my name's Chad Ferris. I'm a veteran service officer here in El Paso County. You know, as far as our role, you know, there's not, we've only had one issue where a veteran complained about getting to our office as far as for us to help file a claim. And that, you know, there's a bus stop right in front of our office, you know, probably 200 yards away in front of the Federal Credit Union, if you know where we are on Championship View. I checked with Richard over at Mount Carmel. He said he hasn't had any complaints, but I think, you know, I agree that kind of the biggest issue is more appointments, you know, getting people, you know, to the VA clinic here in town. You know, I know somebody mentioned DAV. You know, I don't know, pre-COVID, they had a bus that would take veterans, you know, to Denver, to the VA clinic there, but, you know, you had to catch the bus early in the morning, and if your appointment was at 1 o'clock in the afternoon, you just had to sit up there till your appointment, you know, things like that. But there's definitely, you know, a gap, and there are grants that the state of Colorado has, but it's not something our office is able to facilitate at this time, just because we would have to have a full-time employee that just deals with grants and, you know, the parameters with administering those and, you know, making sure that, you know, requirements are met. So but it is the biggest complaint that we see is, you know, getting to appointments, not necessarily, you know, coming to our office or over to Mount Carmel, you know, when it comes to filing claims and things like that.
You brought up the whole funding angle, Chad, which for a lot of us in that transportation space who would like to be able to serve vets, I am aware that if a veteran is dual eligible under Medicaid, we can get that ride covered if they are over 60. Through PPACG and the Older Americans Act, we can get that ride covered. If you are a 40-year-old vet who is able-bodied, you may be low income, but if you're not on Medicaid, what is their recourse for getting rides funded with somebody in town other than doing fixed route? Are there other funding sources through the VA? To my knowledge, VA does not pay for transportation, but I wanted to hear from you.
They do pay for transportation. There is a beneficiary travel service. And Chad, I don't know if you can speak to that better. I know there are currently big challenges with getting reimbursed through that program, but there is funding available. Chad, do you have any more details on that? I can get you the details. I don't have them. I can connect you with.
Yeah. So, I mean, as far as the VA, I mean, they reimburse, you know, if somebody from Colorado Springs has to drive to Denver or Golden, you know, they fill out a travel voucher and the VA reimburses them. They send them a check or direct deposit, you know, whatever mileage is. But, you know, as far as, I mean, it would be great if, you know, because like you said, SilverKey only does 60 and over. And if somebody's a younger veteran that just happens to be low income, and, you know, I just had this conversation today with Jennifer here. I'm like, there's a whole demographic that, yeah, you may have somebody that's fresh out of the military, doesn't have a job yet, so they don't have any income really coming in, and, you know, they have to take a Uber or a Lyft or a bus to get to like a QTC appointment so that they can complete their VA disability compensation exam. And, you know, they may just say, forget it, I don't have the money, I got to pay rent versus going to this appointment, or I got to pay groceries or whatever it may be. And it's like, how do we overcome that? And, you know, it would be great if our office could, issue vouchers, but again, that opens up a whole nother, you got to have a full-time employee to manage the grants. It would be great if Lyft or Uber if we could partner with them to, pay the veterans, ride fee or whatever. But again, now you're talking about, grants and how do you manage that? And that's just not, our office unfortunately can't handle that. But your initial question is, the only way I know that the VA pays for it is they just do the travel reimbursement that you submit when you go to your appointment, and then you have to wait on the VA to mail you a check or do the direct deposit.
Maybe I hope you can answer this question, Chad. I know under Medicaid, under non-emergency medical transportation, reimbursement is if you are driving yourself or if you need assistance from a friend or family member. You can get reimbursement for all three of those methods. Does it work the same way if somebody is seeking reimbursement as a veteran, if a family member drove them or an acquaintance, a friend drove them? Could they get reimbursement that way?
To my understanding, yes. I'd have to relook at like the travel voucher form, but I do believe there is if somebody drove them, there is an option to check that box, but I'll have to, don't hold me to that. I'll have to double check.
Okay.
I think for our guest speakers, I do want to kind of let you guys know a little bit about the statewide conversation that's kind of being kicked off amongst transportation providers.
This is Laura Cruz
Yes,
talking.
sorry. Laura Cruz. So every other month, CDOT and CASTA, the Colorado Association of Transit Agencies, we meet every other month to talk about just emerging issues that as mobility coordinators amongst the MPOs, metropolitan planning organizations, and different COGs and transportation regions are dealing with. And this was a discussion that came up this past month when we met. And several of the different mobility coordinating committees, as well as the Council of Governments, have kind of kicked off the discussion all at one time. And so the thoughts are, how do we really synthesize what is currently going on in terms of reimbursement for services, but also how do we make stronger connections and better connections for veterans in our area. And that kind of led to a lot of different things that are kind of fractured initiatives that are happening within the state with different veteran organizations. There's not really a standard care or standard transportation option for veterans, as you guys are kind of mentioning right now today. And so in our follow-up meeting in May, this is actually going to be a discussion at the CASTA conference, and how can we really put together as a state and as a statewide initiative to really have some sort of standard of how we can provide services to veterans, and also how providers that are providing that services can get reimbursed for that. Because currently right now we're pulling from a lot of different sources, knowing that the Veterans Association or veterans, the VA has access to transportation funds. So the goal is, how can, as you guys that work directly with veterans and hearing that right now, how do you see that playing out if there was a sort of a standard of different providers that you guys could contract out with, or directly refer people to you and have a system of reimbursement from a provider perspective. Kind of like how Medicaid has a fourth option where providers actually get reimbursement for rides that they provide to Medicaid riders. So just wanted to throw that out there as sort of a lead off to our larger discussion of trying to figure out how to standardize this across the state.
Can I ask, this is Kate asking for clarity. So you're asking for a third party, like an Envita, a Goodwill, a SilverKey, that would be outside of maybe their scope, that would be then be reimbursed through the VA or some other funding source to cover the cost of those rides? Is that what you're asking?
Yes, and it's not really necessarily outside of the scope of what they're currently doing. They're just accessing other funding sources to do this.
So for example, in SilverKey, 60 years and older, Jason, are you still on? Would still someone, that 40-year-old veteran still wouldn't be covered by SilverKey, but another agency could. At Vita, my understanding is, and again, it could be wrong, there has to be some ADA, a disability verified.
No, not necessarily.
Anymore? Okay.
Not necessarily, because we have funding under 5310, we have funding under the PPRTA, we have numerous licenses that would allow us to do it. So there's no issue in terms of licensing. It is a matter of how do we get that ride paid for.
Got it. Okay. Okay. So that was,
So there's no license that would prohibit us from providing services.
Okay. And would it be required
Same
that it has
thing.
to be to a medical
Hey,
appointment?
same thing here.
Okay. Okay. Thanks, Jason. So so those requirements are off the table. It's just a matter of the services are there if it can be funded, the resources. are there.
Exactly.
Got it. Okay.
Exactly. We're not, as a nonprofit, we're not in the position to provide free transportation.
Understood. So I think, like I said, I think the VA needs to be at the table. I think that there are conversations, because I know that they do things, they have pots of money through that. The ones I'm thinking of, voluntary services, where somebody just got let out of a facility up in Laramie and they need a bus ride back to Colorado Springs. They find there are pots of money to do that. Whether they're the right pots of money, I couldn't tell you. They have worked with the DAV in that, and I don't know, and Chad alluded to it, is they used to have there were a couple of stops they would go up to. And so those local things. So I don't know what's currently available. So there may be some pots of money available. And I think the VA would be very open to those conversations.
Right.
I think, Chad alluded to the Department of Military and Veterans Affairs funding sources. That's a challenging funding source because it will not, salaries are considered administration. So they will pay for you to purchase a bus. They might purchase gas cards, but they will not pay for the salary of that driver if you have non-volunteer drivers. So the Department of Military and Veterans Affairs, sorry you missed the grant cycle this year. They have two, it would be the Veterans Assistance Grant. And that grant cycle is basically January to, I think, March 1st, end of March, I cannot remember now, is when that grant cycle comes through. I would certainly recommend that you take a look at that and talk to, I can connect you to their grants administrator. You'd have to wait until next January. They have webinars, but they have very strict guidelines about what they will cover and not. And generally salaries are not part of what they cover.
Even if it's part of the operational
yes.
costs.
Yes.
That's correct. Yeah, they will not cover salaries. They'll help, to my understanding, they will help, cover the cost of the van or whatever you use, but then the rest is, kind of on the county as far as like insurance and maintenance and having a full-time or part-time person to drive it around.
Something for us to look into, because we all have from this group, I was on mute. I think that's a good thing for us to look into, because we all pull from different funding sources for capital items, for operations. So that is something to look into. One of the things that I've seen in terms of grants available for veteran services is it has to go through, like the grant has to go through a VSO. And so like a direct nonprofit or COG could not apply for that funding.
Which funding source are you talking about?
I can't remember exactly what it's called. It's actually for the more rural areas.
What's the funding source? I'm sorry.
It is the Veterans Administration.
Oh,
So,
okay.
yeah. And so, but it has to go through a VSO, like we couldn't apply for it directly. And so, kind of a flip side question for you, Chad, is you mentioned there is funding sources out there, but you guys don't have the capacity to manage those grants. Are those funding sources that are available out there something that an agency like PPACG or a nonprofit could apply for and manage those grants, partially because we're used to managing these types of grants?
Let me throw out.
Right.
one-
No,
Go ahead, Chad. Sorry.
yeah, no, that's a good question, and I would have to, I don't know the answer to that. Because I know at one point I was talking to Jennifer about it because Marshall's out of town. And she said that when we were under like community services, they have a grant person there, and we were going to try to get that person to help us navigate that process. But if it's something that a nonprofit can apply for and assist us with that, I would have to look into that because I don't know the answer to that.
And I would just add that there is currently a grant open now. It's called the Staff Sergeant something Parker Gordon Fox fund, and it is really around suicide prevention. But it's we will be talking about this at our advisory board meeting next week. It is really a very broad-based collaborative, I think, approach. A lot of it issues. So I think if transportation is a barrier to care and a contributing factor, I think that there may be a chance to include transportation costs as part of that grant. So it's a big pot of funding, and is tied to some other grants or funding sources through the VA. It just came out, and so we're still trying to figure out what's all in it and what can it be. I think it's going to be a multi-partner collaborative grant opportunity. Whether that's an opportunity or not, I don't know. But I think that finding out what is available through the VA, but Department of Transportation, what are those other resources that are there that, are there still COVID dollars that can be transferred? Or I think that there's a lot of opportunity to get creative around that, but I think we kind of need to tie it, frankly, to social determinants of health in order to be able to get it funded.
You do bring up a really interesting point, Kate, and this is something that, and I'm trying to remember, Jason might remember better than I do. There's like a House bill that dealt with behavioral health and substance use disorders, and there's funding that has gone to local agencies that would help people access those services specifically for those who are dealing with behavioral health issues. That's one way to go about it. It is not VA money. It is not money for vets. It is money for people who have behavioral health, substance use disorder issues. And so Invita, I know, is working on contract with a couple of behavioral health agencies. And so we are able to get some rides funded for people who have those issues, but it's going that direction. It isn't because they are vets. Does that make sense?
Yes, there is another, and I don't know if the money's all spoken for, Senate Bill 129, which was approved in the last session, which is the lead on that is UC Health. Mount Carmel's a partner, NAMI's a partner, and it's really around, I think, behavioral health care and peer support, specifically for veterans. I don't know if there are any pots of money. It would be worth having a conversation probably with UC Health and Damien McCabe around whether or not that is a barrier and need that they're seeing. And I don't know if there's opportunity around that. I don't know if they've already figured out their budget. I think they're still kind of figuring out that process, but that might be another opportunity from state funding that's come through. So that's probably more realistic than the DMVA pot of money just because of the limitations on those dollars.
One of the things that you guys mentioned was you provide gas cards, those types of things, financial assistance, even trying to help folks with keeping their car running to get them to places and important things that they need to get to. one of the things that I want to mention is actually something that came up in a conversation with another council of governments in Pennsylvania. So, United Way has done very similar things in the past around different relief times, disaster relief times, but just to make you guys aware, and you mentioned on-demand transportation, Uber, Lyft. Lyft was mentioned in that conversation with that other council of governments as being an easy agency to work with, easy organization to work with, because they have a concierge platform. So it's a specific platform that you can actually book a ride for an individual. They don't have to have the app themselves. So if there's like a person at your facility that needs to get to, you know, the VA clinic, or they're sitting at home and calling you, hey, I don't have a ride. You know, if you guys can't provide direct funding at this time to some of these providers that are on the call, but have the opportunity to provide kind of like a voucher situation, that would be an intermediate type of solution for those types of things. So from the conversations with that council of governments, they try to go down the path with Uber. Uber does not have as friendly of a platform, but Lyft does have a friendly platform that does have a concierge service tied to it. And essentially you guys as an organization would get billed for that. That would not go to the actual veteran. So
When you say you guys, please be specific.
yes, you guys. That would be Chad, your organization, and your organization, Kate. Sorry.
Whoever coordinated that ride would be the ones who would be billed, not the veteran. And so
Correct.
if those our agencies had the funding source to be able to have that system, that might work.
Correct.
Chad, we've also been talking about what are some unusual rides, handling them more as instead of more of a larger community issue. If there are just some individual kind of one-offs, if somebody is, say, for example, needing to get from Cheyenne, Wyoming to Colorado Springs for some reason, it sounds to me like understanding that you don't have the capacity, there is opportunity perhaps if you knew what organizations you could work with and connect with, there might be opportunities to help in those unusual circumstances. Could you talk more about that?
Yeah, I mean, that you're correct. And normally, you know, we refer to, you know, Homefront Military Network or Mount Carmel. Those are the two biggest ones that we refer to. And the problem, you know, it's not that, you know, I would love to be able to say, you know, and I think anybody in our office would love to be able to say, oh yeah, I call up so-and-so, but, you know, as a county, you know, if we haven't vetted certain programs or sources, if you will, where, you know, Mount Carmel, Homefront Military Network 211, they have vetted, you know, organizations or, you know, referrals that they give out where, you know, the county, that's a liability thing. You know, we can't do that. So we just refer, you know, to those organizations and hope that, you know, one of them is able to assist or arrange whatever is needed, you know.
Mm-hmm.
You know, that's our go-to right now. And, you know, I wish there were more options, but that's where we're at.
So our organizations are going to work on a case management level and troubleshoot individual needs and find out the best fit for them. I would, in terms of one-offs, yes, definitely. So that's, again, if it's someone's leaving a VA facility in Cheyenne and coming to Colorado Springs, I'd go back to the VA and say, do you have that transportation capability? There are other things that probably, this is another challenge I would think, is that someone is living here and has a veteran relative, a mother or father, that they want to get here because they are going to become their caregiver. There's no way to do that interstate transfer. There's some interstate kind of, ambulatory care or, some
Mhm.
medical rides in certain levels, but, getting from one state to another is certainly a gap.
That's difficult. Yeah.
And so, so that's a challenge one way or the other coming into or out of, I'm just a vet. I'm trying to get to Houston because I hear it. Now, from a homeless veteran standpoint, there are programs where you have family supports rather than be homeless here. You can go back to Florida and live. There are some transportation dollars to do some of that on a case by case basis. But in terms of, the one-offs that you were talking about,
Right.
those are bigger challenges. But
right. I do know, and there may be other agencies on the phone that want to jump in, and I would encourage you to do so. I know it in Vita, we often get some of those very unusual calls for rides. It might be down to Alamosa. It might be to Bent County. Our attitude, our mode of operation is to figure it out. And we want to say yes. That's our first reaction is, if we say yes, how do we make this work? And have the discussion from there. So I would like to throw, at least in Vita, out there as an option for some of those one-offs that are really unusual circumstances. If we can work out how to work out the funding with whoever gives us a call, then chances are we can make something happen. I don't know if there are others that are on the call that want to jump in with their availability or interest in providing that type of service.
don't everybody speak at once.
I think this is a good ongoing conversation. Go ahead, Jason.
Yeah, this is Jason. Thank you. Just real quickly, I was going to say, we certainly can be part of the solution. We want to be. I know that there's been a number of times saying about 60 plus, but in fact, the way that we've approached our support systems now, and we've changed this a lot. We were originally geared more to the funding stream, but now what we've done, which of course in our system is primarily the Older Americans Act and funded through AAA, but we also believe that our core competencies work for some individuals that are younger than 60. So we have been able to find different solutions to be able to help with those where it makes sense for the type of ride that we have, the type of drivers that we have, what their training is, to be able to work with a broader audience. And we'd be glad to be part of that conversation as well. Thank you. Sorry about that interruption.
Yeah. And Jason, I'm going to put in a quick plug for our collaboration. SilverKey and Envita work very closely with, there's a collaboration with Fountain Valley, SilverKey, and Envita. And often what we're able to do is coordinate. So maybe one of us is able to do that ride, which means another one is going to do something else, so that we're able to help make that ride happen. So within the collaboration, we can sometimes work together on these things.
Laura, can I ask you a question? You talked about their statewide conversations specifically around veteran transportation. Who's at the table at that? Are there other, again, folks that because we're always trying to find the answers to that question too.
Yeah, and so that's a great question. Literally, this was kicked off last month as just kind of an aha moment. CASTA, again, is the Colorado Association of Transit Agencies. Yes, got it. I don't never know what the S is for. So, but CASTA is the advocacy body or arm of all of the transit agencies in Colorado. So they work on policy, but also training of transit providers. And as I mentioned, the Council of Governments and the transportation planning regions, we meet every other month to just discuss things that kind of overlap with each other. And it was amazing when one of the Council of Governments was presenting on just a very early stage collaboration that they're trying to do with the VA in Denver, that the resounding noise in the room was, hey, we're trying to figure this out right now too. So we kind of took a step back as a group and said, let's put the brakes on this and let's think about this from a statewide perspective. How can we find solutions? Again, back to that standard of care. So we're kicking off the conversation at the CASTA conference in the spring. It will be here at the Antlers Hotel. And trying to kind of assemble ourselves as transit providers to figure out who we need to be bringing to the table, and would definitely like to invite you guys from this region to be a part of that conversation as we sort of assemble how we're going to manage this. Obviously, the big conversation is who are the stakeholders that need to be at the table. And then we actually invited the VA today, and they have not jumped on the call. So I think that you brought up a point earlier that the VA definitely needs to be at the table as sort of.
Who did you invite?
What was?
Let's talk offline at that, because when I don't know if it was the right person, we can help facilitate that.
Yeah. So yeah, that was a little bit of a bummer to not have them on the call today, but definitely I feel like this is something that needs to start with the VA, as you mentioned, and kind of figure out how they want to manage this from a statewide perspective, since we're opening the door as transit providers and saying, hey, we're here to help, but we need a way to do that.
Just a couple of things, not to speak for the VA, but they are in the middle of a very big restructuring of VA services nationwide, but particularly in our region and across the state and across all the states that will have major impacts. And so they're kind of, they're a little bit busy on that. That being said, Homefront Military Network convenes a quarterly advisory board meeting, which meets next week, where that includes our CVAP, our CVAP, you think I would know what that stands for? Community Veterans Engagement Board for this region. And that's really an opportunity to kind of raise what are the key issues. Veteran suicide comes up, housing and those types of things. So I'm going to tell you right now, I'm going to add transportation and invite whoever the right person is to come and kind of talk about, hey, here's an issue. We have a lot of folks at the table, including VA, including military installations. Not sometimes when you have military families, you got one. Not outside of this conversation, you got a family who the soldier works at Fort Carson and the spouse, and they're living up at the academy and they only have one car. That presents its own issues. That's not uncommon. But I think I'm going to offer that as an opportunity to at least open the aperture, raise the awareness. And then it won't be the place to solve the issues, but it'll say, if this is of interest to you, you want a seat at the table, who's the belly button? Because that's what we try and do, is connect the dots. So I'm going to offer that as an opportunity to add that discussion, and at least might get you who are the right folks who should be at the table. It might have raised the awareness with whoever, if you ask somebody from the Lindstrom Clinic or from Eastern Colorado Healthcare System, because then they're going to have bigger conversations system wide. And then what covers a different area covers Grand Junction and what, and so we can help connect the dots.
What date is that meeting? Well, okay. Okay, great. Okay. Yeah, if you don't mind sending us information, we'd love to send a representative, and maybe as a executive committee, we can kind of talk about who would be the right person to send to that.
And offline, I'll get you the information on CASTA for you. Let's open this up for others who are on the call who may have questions for our panel this morning. What questions do you have about serving veterans in this community?
So this is Melissa. And I'm just really amazed to learn that you guys are talking about the folks who are under 60 a lot. These younger veterans that are really finding that they're stuck, trying to get access to transportation. I had not really thought of that. My picture is this older, disabled veteran, older veteran with a disability who's trying to get around. And so to hear that you guys are dealing with such a younger population and really struggling with meeting their needs was new to hear today. So thanks for enlightening me on that level. And again, I just looked to the work that Envita did to partner up with the new housing program out there to make sure that there's some transportation happening. But yet again, how do you meet the needs of those younger people out there? So interesting, Kate.
Yeah, the veteran population here, and this is the fastest growing, one of the fastest growing, and the highest concentration of veterans per civilian population, or one of the highest in the nation. And your image of that sort of Vietnam era older veteran is not typical for this region at all. They are younger, but also in terms of the population, the demographics, you're talking about 40-year-olds who've been carrying a 60-pound pack for 10 years in a very difficult environment, so that their bodies are breaking down faster. And so the challenges that you and I might see it not having those experiences at 60 might be happening earlier. A lot of folks, with hearing challenges because of explosions and other things. And I'm sure Chad can speak to it, even better than I can. So this is a younger veteran population. We have 5 military installations that are sending, folks out into our community on a regular basis that transition. You want to live here because, like today, it's an awesome place to be. And because there are a lot of services here. Are there enough services? No, are there ever anywhere? So we're trying to figure out how that swirl, and that's kind of what our role is, to kind of bring the swirl together and be that belly button to connect people to the right folks. So to get to the veteran population is definitely younger, but with needs and challenges that are that you may not think of as typical.
Yeah, the one thing that I can think of here as a solution is Envita is a recipient of FTA 5310 funding that we receive through the management underneath the PPACG. That is for public transportation. That is for individuals who, for some reason or another, cannot access
2022
the fixed route system. So in other words, they do not live within a mile of the fixed route system. They cannot access it. They cannot in any way get the services they need. They can give specialized transit like Envita a call. And we can use public 5310 funding to give that individual a ride. It is a limited pot of money, but it is available. Again, this is not for vets. This is for the public. But vets are part of the public. And so it is another solution to think about for your individuals who are struggling with access to transportation.
Yeah, and I want to piggyback on that just to kind of clarify as well. So 5310 is funding, what it's called is for the enhanced mobility of seniors and individuals with disabilities. So most of the folks that you are probably dealing with have some sort of disability, which really falls within the spirit of that funding source. We have MMT on the line. I believe Allison is on the line. And I don't know how directly you guys have worked with MMT through their paratransit services, but as a specialized transit service group, really the coordination is to fill those gaps where paratransit service isn't able to, as well as fixed route is not able to for that disabled and senior population. So Allison, I'm going to put you on the spot. Do you want to step in and say, how people can, for our panelists, how people can access your services depending upon kind of the different needs of the individual?
Sure. Let's see if I can answer correctly. Really, it's going to be, I mean, if it's not fixed route, then it's going to be going to the ADA paratransit service. And for that service, there is an application process, an eligibility process that sort of goes through what disabilities you have or what difficulties you have that would preclude you from taking a fixed route in order to qualify. Now, it's something that we don't necessarily get in the weeds with, but there are tons of funding sources that choose to fund for paratransit services, Metro Mobility. However, us just being the city, we don't really get into the weeds of who pays for what. But, you know, we have different schools paying for stuff. We have Medicaid paying for transportation trips. And so, you know, I think it's going to come back to like Chad was saying, or as we're all saying, who's going to take that lead to get those grants from the VA in order to be able to funnel the money through paratransit if they do have a disability that they would qualify for to ride the services.
Can I ask a question about that in terms of paratransit? Is that just going back in the days, and I didn't pay close enough attention when I worked at PPACG, I thought there was some issue about it within a mile of the fixed route. Is that what paratransit does, or is that something else?
Nope, you're absolutely correct. It's actually 3/4 of a mile within a fixed route are the services that we provide.
So just to kind of let you know how it kind of works is if somebody calls in, and you can correct me if I'm wrong, Allison, if somebody calls in to Metro Mobility for paratransit services, essentially Metro Mobility will screen where that person lives and whatnot. And same thing for Envita and our other agencies. They'll ask the questions of where somebody lives, where their trips are, to make sure that their services match up with it. And if not, they will refer people out to the agency that it does match up with. So there isn't an expectation from y'all, Chad and Kate, your organization, to kind of navigate that. But we can offer the two different services, and they do screen individuals to see what's the best fit.
So in reality, what we try and do is limit the noise on that. So what we want to do is ask enough questions of the people, because we don't want to send them to 4 different places to ask that question. But the other thing I'm going to ask is that we have I have 2, I mentioned that advisory board meeting. That's more of a kind of a policy level, big picture conversation. We have a partner agency meeting that meets monthly. We used to meet in this building too, the second Thursday of the month. So the following, the 12th at 10 o'clock, also we'll have a Teams link where I would love to have some folks talk about, and I don't know if by then the handbook or whatever you mentioned would be out. That would be a great and that's more of a case manager level. So that would be a great way to let people know what's available, what's not. And I think you will also get good feedback on very specific and very, client challenges. And so I would invite all of you who can, I'll follow up with probably you, Laura, to say who might be, and maybe Allison from Mountain Metro Transit to talk about, here's some transportation resources, because it comes up as a gap. I invite you to come to that meeting too. I'm just going to, you didn't think you were going to get more work added to you, but I think it will open up doors, because there's a networking piece too. So to kind of find out where the links are, and then who are the right resources to ask if people don't know. I know our case managers probably more in the weeds and have much better clarity on, if they're working with a client, what's the right fit for them. I don't have I'm a 30,000 foot level person, or try to be. So I don't have all that, but I think it would be great information to share with the people who don't do this on a regular basis, but work with veterans and families on a regular basis. It'd be great to make that connection. So if I'll follow up with you on that. But again, I think it opens the door for the conversation. And
absolutely.
Find the pieces.
Well, and just to let you know, Kate and Chad, we actually just received a grant from the National Association of Disability Transportation Center.
Yes.
For a needs assessment in this area, and trying to work together to put together a steering committee for that project. This will flow into our specialized transportation plan, which will be kicked off in the late summer, early fall. And what this needs assessment is really just to identify these gaps and understand these challenges of individuals in our community, to better inform how we work together as agencies to address those needs. And also understanding sort of from a policy perspective, what are some of those challenges that really inhibit, us kind of keeping the customer at the center of things. And so would really enjoy some pull from your groups to help as stakeholders. And we're actually going to be putting together some focus groups to talk about specific needs and specific needs from specific populations in our community. And so I'm going to throw something back at you, but to help us with forming a stakeholder group for and focus group for this veteran community. So.
You know, there's also an opportunity here. We've been asking questions of Kate and Chad as we continue this discussion for a couple more minutes. Do you have any burning questions of the agencies that are a part of the MCC?
What are you doing on May 12th? Kristen, I know a lot of your teams already participate, but just love to have a good conversation around veteran transportation needs that again could feed into this potential stakeholder focus group and then feed into the bigger picture conversation so that at least it raises the issue more directly. Hi, Kristen.
Hi, good to see you. Yeah, no, I know a lot of our rehire folks and other people attend, and my job has changed over the years. So I'm kind of here and there on different meetings, and then got volunteered on this committee, even though I don't have as much to do with transportation, but I like to definitely connect everyone. So I'm happy to kind of keep passing on the word and have people attend that. But good to see you. Thanks for coming today.
Thank you.
I'm working on the follow-up on that. Who do I need to get back? Is that with you, Laura, or to see if the nonprofits can access those grants or funds through the state?
Yes, Chad, if you want to send that to me, that would be great. And I can email you after this.
Okay.
So you have my contact information.
Perfect, yeah.
Because I hold, I have an MCC list that can kind of send information out to the providers. Specifically, if you guys ever have anything that you think would be relevant for this group, just some information you want to pass along, maybe a grant opportunity or a change in policy that you would like to pass along, feel free to send that to me and I'll make for sure the rest of the group gets that.
Yeah, I'm going to start working on that, but I just want to make sure that I follow up with the appropriate people.
That'd be great, Chad, because this whole mobility coordinating committee is designed to be a gathering place where we can discuss these issues and disseminate information that's for the good of the community. So please use us, get us the information. If you need some folks to step up, this is a great way for you to get information to one place that can then be disseminated.
And Chad, I just want to clarify one other thing too. If you can, as you're doing your research, look at it from not just the nonprofit perspective, but also other government entities, because there's some things that Council of Governments can apply for that is not applicable to a nonprofit, but we can subcontract or whatnot with nonprofits. So that's an opportunity as well in the future.
Yeah, depending on who's eligible to apply. Yep.
My radar is
Okay, yeah, I
more
can do that.
engaging in seniors and housing resources, but I'll kind of
That'd
add
be great.
transportation to that list.
Well, Chad, Kate, thank you so much for joining us today. Really appreciate the discussion. I'm going to look at our agenda here and see what else we have going on this morning. We don't have any other action items or membership appointments today. And so our next MCC meeting is, who has that date handy? I do not. It's going to be May. It's probably the week of CASTA, right? We may need to change it. Yeah, so it's probably, so it is, it's the week of CASTA. So depending on people's involvement in CASTA, we may have to talk about getting word out on whether we want to have that meeting or if we need to move it. So stay tuned for more information on that. Tentatively May 24th, but we'll see what happens with that. And other than that, I think we're ready to adjourn. Thank you all very much for participating today.
Hey, thanks for having me. Appreciate it.
Yep. Have a great day.
Thank you, everybody.
Thank you, guys. Appreciate it.